Is a throat swab the best way to test for strep throat? When your child is feeling really sick with a sore throat, fever, and trouble swallowing, you might wonder how doctors find out if it's caused by strep bacteria. The most common and effective way to test for strep throat in children is through a throat swab. This involves gently rubbing a cotton swab on the back of the throat and around the tonsils to collect a sample. The sample is then tested to see if group A Streptococcus bacteria are present, which is the main cause of strep throat. There are two main types of tests using the throat swab. The first is the rapid strep test, also called the rapid antigen detection test. It can give results in about 10 to 15 minutes. This test works by detecting specific parts of the bacteria called antigens. It is very good at correctly identifying children who do have strep, with about 95% accuracy, meaning it rarely gives false positives. However, it can sometimes miss infections, with about 15% of true cases not being detected, leading to false negatives. Because of this, if a child has symptoms strongly suggesting strep throat but the rapid test is negative, doctors often do a throat culture as a follow-up. The throat culture takes longer, usually about 24 to 48 hours, but it is considered the most accurate test. It involves growing bacteria from the sample in a lab to see if group A Streptococcus is present. This method is more sensitive and can detect infections that the rapid test might miss, making it the gold standard for diagnosis. For children, the quick results from the rapid test help start treatment sooner, which can reduce symptoms, prevent spreading the bacteria to others, and avoid complications like rheumatic fever. But because the rapid test isn't perfect, a throat culture is often done if the rapid test is negative but the child's symptoms strongly suggest strep. It's important that the throat swab is done correctly, swabbing both the tonsils and the back of the throat to get enough sample. The test detects bacteria on the surface of the throat but cannot tell if the bacteria are causing illness or if the child is just carrying the bacteria without being sick. That's why healthcare providers also consider the child's symptoms and overall health when interpreting test results. In summary, a throat swab is the best and most standard way to test for strep throat in children. The rapid test provides quick results and is useful for immediate decision-making, while the throat culture offers a more accurate diagnosis when needed. Combining these methods helps ensure children get the right treatment at the right time. Always remember to consult a healthcare professional for proper testing and diagnosis, as each child's situation can be different.